Okay, well, it's really a privilege and a pleasure to be here today. And also really exciting to be part of the same session as Michael. Two Canadians. It's always enjoyable to see him. So um, I thought I'd start today with a bit of background to this project and how it got started. An anthropologist, a civil engineer, various psychologists, computer scientists, a whole bunch of different types of academics didn't walk into a bar. In this case, we walked many times into the same conference room over the course of about a year to talk about community resilience. And we were brought together by the engineers, actually. Um, these are the two engineers in question. As usual, they look pretty pleased with themselves. And they've been studying what they call community resilience for a long time. And when they study community resilience, what they like to do with sophisticated modeling is create these sort of curves. We call them recovery curves at the bottom of the slide. There's some sort of disruptive event, some sort of disaster. It interrupts the functionality of a system. It could be like the electrical grid or the phone system or the road networks. And then over time, there's some sort of recovery of those systems. And so they measure resilience in terms of how low does the functionality drop in the face of disaster, and recovery sort of how quickly and to what level do things get back to normal. And they talk a lot about community resilience, but have realized over time that they actually know very little about the communities that they're studying. What they know a lot about is electrical grids and how quickly you can get phone service back online and so on. But they don't know much about how disasters affect the people who actually live in communities, or how the infrastructure components they're really interested in relate to the experiences of ordinary people, the citizens who live there. And so they brought a bunch of social scientists onto the team to try to figure out how can we create some intersections between what social scientists know about communities and people and what they know about, bridges and roads and electrical grids. So we talked for about a year, and we decided, we came up with a plan. What we're going to do is conduct research in North Carolina, which is on the East Coast of the United States. And we were going to conduct focus groups. It was going to be led by the anthropologist on the team for people who'd been devastated fairly recently by a hurricane that hit the coast. Lots of flooding, lots of damage. And then we got some money for it. We hired a postdoc to do it. And then things started to go off the rails a little bit. In particular, we started hearing about this novel coronavirus. It was in China, then it was on cruise ships, then it was in Italy, and then soon it was in the United States and everywhere, of course. And it was really clear that we weren't going anywhere, and we certainly weren't doing face-to-face interviews with anybody. And yet we still had this money, and we had a postdoc without much to do. So we figured out ultimately that we would try to answer at least some of the same set of questions with a different sort of disaster or catastrophe, which was the pandemic. And this is a multifaceted project, and I'm going to tell you about a piece of it today, which is a fairly large multi-wave survey that we've been conducting of US residents. The first survey went out in early April last year to 2,500 residents, and then we followed up again later that month, a third time in June, a fourth time in October. So we have this nice longitudinal data set. Because it's people from so many disciplines, there's all sorts of things in it. Some fascinating to social psychologists, some not so much. I'll give you a couple of snapshots of some interesting things that we actually have papers under review for, and then talk about identity, which is the main thing I want to talk about today. But to just give you a couple of snapshots of other interesting things. So there's been a lot of discussion, a lot of interest during the pandemic in the trust that people place in experts. And it seems like societies that have done better, typically at least, have had populations where people trust the experts and listen to their advice. And this seems like a really good thing. What we've found in our data, though, is a bit of nuance to that it matters what they trust the experts for. And so to give you an example of this, we ask people about how much they think experts understand the transmission of the virus. And what we found is the more people think that experts understand how it's transmitted between people, the more they listen to experts' advice, the more social distancing they're engaging in, the more mask wearing, the more quickly they're likely to take a vaccine. But on the other hand, if they thought that experts understand how to treat the virus, so how to actually medically deal with it if you get it, actually had the opposite effect. Then we see less distancing, less mask wearing, less likely to take a vaccine. And then conceptually, it makes sense, right? If you think the medical community knows how to treat it, it's less risky, and therefore you don't have to take as many precautions. But it seems like this expertise issue and trust in their expertise is a multifaceted thing. And I think throughout the pandemic, we've seen public health experts really struggle to walk the fine line between these two things. So on the one hand, saying, we're the experts, you should be listening to us, at the same time as having to say, well, we don't really fully understand it, so our advice might change, and that's okay. And oh, by the way, because we don't really understand it, you should be really careful and listen to us. And that haven't always been fully successful at sort of walking that line. We also looked a little bit at the lenses that people were viewing this very novel, unprecedented event through. Different sort of analogies you could use to understand the pandemic. I'm not going to dwell on this, but one analogy that actually turned out to be fairly common among our participants, at least early on, was to see it through this apocalyptic kind of narrative lens. So comparing it to zombie movies or the end of the world kind of stories. This didn't predict particularly good health-related behaviors, but what it did predict was hoarding. So the more you saw it as apocalyptic and zombie-like, the more people were hoarding toilet paper, food, and other essential supplies. But what I really want to talk about today is the identity side of it, and in particular, how people drew upon social identities as potentially a source of resilience throughout the pandemic. And of course, for this work, we were directly inspired by the wonderful work that many of you have done yourselves on the social cure. And I'd be embarrassed to try to give an in-depth theoretical explanation of the idea, but suffice it to say that the central premise, at least as I understand it, is that people's social identities and the groups they belong to have a significant impact on health, physical and mental, and that particularly during difficult times and catastrophes or challenges in life, these social identities can be a source of resiliency or a source that can be drawn upon to help navigate these situations. Now, theoretically, maybe not any, but many different kinds of identities could serve this sort of function. But as we were thinking about the pandemic specifically back in April 2020, we thought there was a bit of an interesting paradox, which was that the pandemic is this massive global event, right? It's affecting people all around the world at the same time. But the experience of it for people, for a lot of people at least, was actually intensely local, right? So when you stop moving around, when you stop traveling, when you stop leaving your house even to go to work, right? Suddenly your world shrinks down to the place you live, to your local community. And not just that, but in the pandemic, what's happening in your local community maybe became more relevant than normal. So it became a question, does my grocery store have enough food or enough toilet paper? Is my local hospital overwhelmed so that if I got sick, I couldn't, get care there? So we thought might be the case, especially in America, which is a very car-driven culture where people's local communities aren't necessarily normally that important to them. That in the pandemic, the local community and identity they might get from that might actually be more important than normal and perhaps a pivotal factor in their resiliency over time. So what I'm going to do for the rest of the talk is step through a set of questions that we can try to address with some of the data we collected. And the first is exactly that, which is how important were the identities that were grounded in people's local communities, as opposed to social identities that they might be drawing from other groups that they value, that they belong to. So we had to give some careful thought to how would we define local community. This is what we came up with, and I think it actually worked quite well. So we told people by local community, we mean the people you live around who tend to be in the same places like parks or streets and who use the same amenities as you, grocery stores, gas stations, banks, etc. People answered all kinds of questions about their local communities, including typical kind of identification questions. So I feel a sense of connection to my local community. I'm proud to belong to my local community. We also asked people to identify a set of groups they belong to that they cared about, to pick the one that they were finding most important to you right now during COVID-19, and again, answered questions about identification with that group. As you might expect, this is showing you mean levels of identification for the community they live in, as well as this group they've identified as most important to them. Unsurprisingly, they're more identified with this most important group. The error bars on this graph are standard deviations, which is unusual to bother showing you on a graph. But I wanted to show you this variance on both of these, which is going to matter if we're going to try to predict outcomes from these variables. And the critical outcomes for today are mental health related indicators. So we assess stress using the perceived stress scale at every time point. And then in October, we also assess depression. So these are going to be the key dependent variables I'm going to talk about repeatedly. And so the first question is, well, before I get to the first question, I'll show you stress over time. So this doesn't look like a whopping effect, and it's not, but it's showing you that stress was highest in April and it decreased steadily into June and then through October. There are data points. And this doesn't look, particularly dramatic or anything, but if you look at the individual level, you can see there's a lot more going on for people, or people's experiences were quite different. So I chose 12 random respondents, plotted their stress levels over time, and you can see different people are having very different experiences. There's a wide range of stress, and for some people it's going up over time, other people it's going down, and so on. So what we're going to be doing is predicting stress at these different time points from the two forms of identification. How identified were they in April, early on in the pandemic, with their local community, as well as this group they'd identified as very important to them. And to orient you toward the graph, most of the graphs are going to be like this. What I'm plotting are regression coefficients, or beta standardized coefficients. So it's showing you what's the strength of the relationship between the forms of identification and, in this case, stress in April. And so what we see is that there's a significant negative relationship between how identified they were with their local community and their experiences of stress. So they're less stressed the more identified they were with their local community in April. There's not a significant relationship between identification with this most important group that identified. So if the bar is not colored in, it's a non-significant relationship. So if we look at this across time, basically we see the pattern holds. We actually see that these relationships between identification and the indicators of stress, and then ultimately depression in October, actually get a bit stronger over time. So again, the more identified they are with their local community in April toward the beginning of the pandemic, the less stress they're feeling in June, and then 6 months later in October, the less depressed they are. And then by October, we also see that identification with the important group that they dominated has become significant, but it's still significantly weaker as an effect than the influence of this strong identity with the local community. But what we were ultimately really interested in wasn't so much their feelings of identification with the groups, although that's important, but what they were experiencing with regard to the resiliency of those groups, and especially their local community. So the next question we can take a look at is, how do people's perceptions of solidarity and resilience within their communities in response to this pandemic relate to their own individual resiliency? And so not just how identified are they, but how do they think their communities are responding? And so we assess community resilience in a couple of ways. I was really interested in the solidarity piece of it. So items like, I feel like people in my local community are rallying to support each other in response to COVID-19. And then especially for Michael, since he's here, we had an angst measure. I feel anxious about the future existence of my community. This shows you how those variables changed over time. The top line on this graph is solidarity. The bottom is angst. You can see people always felt more solidarity than angst. But solidarity goes down over time. So they're feeling like the communities are rallying less well as time goes on. Angst actually drops from April to June and then goes back up again significantly into October. And importantly, these are not opposites to each other. It turns out that solidarity and angst are actually slightly positively correlated. It's a small correlation, but it's positive, which means that you could feel like your community is rallying and finding common purpose, but also be really worried about your community's future. And it turns out this is important because they consistently operate as completely independent predictors of the mental health outcomes. So this is going to be a similar graph to last time, again, showing you the strength of the relationship between, in this case, solidarity measured in April and angst measured in April, and then stress at various time points. So we see that solidarity in April is predicting less stress in April, and feeling angst in April, concern for the future of your local community, is predicting more personal stress at that time point. And that those relationships hold over time. And these models include the community identification scale. So this is over and above feeling identified with the local community. Feeling that the community has solidarity is a positive, or I guess a negative contributor to stress, and feeling worried for your community's future is a positive contributor to stress and to depression ultimately. But solidarity and angst were not static, right? One of the things about this pandemic, unlike a lot of the disasters that we'd planned to study with our research group, which is sort of an event happens and then there's a long recovery period, this event has gone on and on and on, especially feels like in the United States. But I really haven't left this room in about a year. It's gone on and on and on. And so people's perceptions of how their communities are doing have changed over time. And so this leads to the next question, which is how did changes in those perceptions of community resilience over time relate to individual resiliency? And so we thought, and this was the hypothesis, that if you thought your community was rallying in solidarity in early April, that's great. But if you think that solidarity decayed over time, that might be further predicting negative mental health, so more stress or more depression. It turns out that's the case. So these models include not just solidarity measured early in the pandemic and angst measured early in the pandemic, but change in those variables over time. So we start with the dependent variable being stress in June. The first two bars here are what I've already shown you, which is that solidarity in April predicts less stress in June. Angst in April predicts more stress in June. But the next two bars are the change predictors. So change in solidarity from April to June and change in angst from April to June. And a higher score on the change variable means there's more, that variable was maintained more over time. So those people who felt that their communities had maintained solidarity, a fairly high level of solidarity from April to June, felt less stress in June. Those people who thought that angst had been maintained, on the other hand, they'd been worried, and they're still worried, or they're more worried even by June, are feeling even more stress in June. And the same patterns hold all the way 6 months out into October. So once again, if you thought that solidarity in your community has been maintained over time, you're feeling less stressed, even less stressed than just feeling solidarity early on in October, and less depression. These models account for about 20% of the variance in stress and depression in October, so 6 months after the initial assessment, which I actually think is really kind of remarkable. It's also something to note, which I haven't highlighted so far, which is important as well, which is, I haven't shown you, but these effects all hold if you control for stress measured at time 1, so stress measured in April. And what that means is it's not just that, say, solidarity, feelings like your community is rallying in support of one another. It's not just that they predict absolute levels of stress, say 6 months later in October, but it's also actually predicting change in stress levels, so that the more solidarity you experienced early on, the more likely it was stress went down, or stress went down more for those people over time than for people who did not feel solidarity early on. And so that logic of change holds for all of these relationships. Just gonna check the time for a second. Okay, so the next question we can ask is, well, where did these feelings of solidarity and angst come from? And one of the things that I think is really fascinating about social identity, especially in the event of disaster, is this idea, so I think of work by John Drury and others, that disasters can give rise to a sense of emergent identity, right? So you may not have had much of an identity before, but in response to some sort of catastrophic event, people can find a sense of solidarity. So the question is, did challenges that people experienced in their local communities give rise to an emergent sense of identity in those communities? And do we have any evidence for that in our data? We do have some. So because this involved engineers, we had to ask about infrastructure, which are not questions I would normally have bothered asking about. But we asked about, like, in your local community, how affected has the electrical grid been and the internet and phone service, as well as a bunch of things like grocery stores and hospital networks and business activity generally. Infrastructure sort of breaks into two categories based on a factor analysis. There's some classic infrastructure like electric grids, and then what we're calling civic infrastructure, which is the more day-to-day interacting with other people, getting your food and essential needs met kind of thing. And what we can ask is, do local disruptions to these things relate to or predict feelings of solidarity in the community, and also potentially angst in the community? So is experiencing local disruption to things that you expect should function well and now no longer functioning as well a source of angst, which would make a lot of sense, but also potentially a source of solidarity? And it turns out that at every time point that seems to be the case. So that here, back in April, we see the more people thought there were problems or changes to this infrastructure of both kinds, they're experiencing more angst, but they're also simultaneously experiencing more solidarity. They're thinking that their communities are rallying more strongly in support of one another. And that same pattern holds in June and October as well. So we think there's at least some partial evidence for this idea of there being an emergent identity at the local level in response to the pandemic, broadly speaking, but also to local specific challenges that people were encountering, getting access to food, as well as things like, electrical grids weren't particularly affected by the pandemic, but it turns out that if there is some other sort of event, like a hurricane or an ice storm or something that knocks out electricity, it takes a lot longer in a pandemic to get that service back. The final question we asked was, we've seen lots of evidence that these social identities, especially this local community identity, mattered. It seemed to have an influence on people's resilience over time. Was it also the case that these identities buffered against the negative effects of other unfortunate events? So in the course of a pandemic, people experience a lot of negative things. I'll show you two examples, but to foreshadow, and spoiler alert, the answer seems to be no. So we don't have good evidence that these social identities actually serve a buffering function. They're not making the negative effects of other bad things work less bad, even though those identities are obviously seem to be positively contributing to mental health. I'll show you a concrete example of that. So two things in our data set were big contributors or had a large influence on people's stress and depression were losing income due to COVID-19 and also knowing someone who contracts the disease at some point. About a third of our sample at every time point reported having lost income, usually because they lost their job due to the pandemic. And then you can see over time, a steady increase in people who are saying they know someone who has the disease, up to 50% by October, which was fairly remarkable. And so what we can do is ask, does say feeling solidarity with your local community buffer against the negative impact that this sort of event is going to have on stress or on depression? And what would a buffering pattern look like? This is the sort of baseline effect I've been showing you all along, which is that the more solidarity people felt, the less stressed they were. And so we'll say this is sort of baseline. This is what people might show if they haven't experienced a significantly negative event like losing their income or knowing someone who gets the disease. And what you'd expect for a buffering effect is an even stronger association between solidarity and stress in a negative direction when someone's encountered some sort of negative event. And this should be driven by the people low in solidarity. They experience a negative event and it should really affect them, right? Stress should go through the roof. Whereas for people who feel high solidarity, it shouldn't affect them as strongly if the solidarity is a buffer. It should be a protective factor so that negative event is not having as big of an impact. Well, I'll say is we saw very few interactions at all between the sort of stressor variables like losing income or your job or other things, and the identity variables, hardly any interactions. And when they do show up, they tend not to be the buffering pattern. So this is one example of an interaction that that did come out significantly. It's only in June, and it's an interaction between losing income and solidarity. And you can see it's not the buffering pattern. If anything, it's that losing income or experiencing this very significant negative stressor sort of undoes some of the positive influence of community solidarity, so that people who felt high solidarity, if they didn't lose their income, are showing less stress. But if they did lose their income, they're showing just about as much stress as if they didn't have a high level of solidarity. So, I think it's showing identity clearly matters, and the sense of solidarity is a really important contributor, or at least has a really strong association with stress, but it doesn't seem to be playing a buffering role. So if someone experiences a really negative stressor of some kind, like losing their income, that sense of solidarity doesn't seem to be a protective factor. All right. So to keep us on track, I'll just wrap up quickly and say, hopefully I've convinced you that our initial intuition about the importance of these local community identities was at least on the right track. It does seem like, especially in relation or in comparison to other kinds of important identities that people had self-nominated, these local community identities, which I suspect in an American sample don't tend to drive a whole lot of things, in the pandemic did. They were significantly associated at different time points and in a number of different ways with these key mental health related variables. So this research program is continuing, and we're about to launch a 5th iteration of the survey. And so one of the things I would love feedback on from you, if you have thoughts and ideas about it, is what else should we be asking? We're hoping to launch like in the next week or two, but there's still time to add or change things in the kind of surveys that we're administering. And so if anyone has any thoughts about that, I'd love to hear them. With that, I think I'll wrap up and take questions.